My name is Sophie Messager. I'm a doula, a healer and body worker based in Cambridge, UK. And I need to do this video right now because this morning I was triggered again by a woman saying she's got period pain and there's nothing she can do about it. And I used to be one of those women. I used to think that period pain was just one of those things women had to suffer. And 5 years ago, I met an osteopath who does visceral osteopathy, and he said to me, I can help, I can release your ligaments. And I was like, why is that going to help? But it did, and I've been pretty much period pain-free for 5 years. And I feel like I'm on a mission to tell women about this because we're still being lied to and being told there's nothing we can do about period pain, and that is not true. There's a simple biomechanics about it. So because I was a scientist, I told my osteopath, well, tell me why it doesn't hurt anymore, because I understand it's caused by prostaglandins, which are hormones, and how is ligaments going to do anything to that? And he said to me, the cramps are still there, it's just they don't hurt anymore. And over the last few years I've done a lot of learning about biomechanics and understanding the anatomy of the pelvis and ligaments, and I'm going to show that to you now. So bear in mind, this is not to scale, because this is supposed to be a pregnant uterus. Your non-pregnant uterus is a lot smaller than that. It sits in your pelvis, but the uterus is attached to the pelvis by several sets of ligaments, and there are three main ones, around ligaments that go to the front. I can't remember the name of this one, but there's a ligament that goes to the side actually of the pelvis, and then at the back there's a sacrouterine ligament that attaches the uterus to the back of your pelvis. Now, the normal uterus, when the ligaments are in the right position, it sits slightly forward, and that means that when it's time for your uterus to expel period blood, so to bleed, the uterus, so I'm going to show you with my body, sits slightly forward. If you imagine my arms here are the ligaments, it's bent a little bit, so when it's time to bleed, and I'm shamelessly stealing that modeling from a lovely Arvigo practitioner called Hilary Lewin. When the uterus is bleeding, it has to cramp to get the blood out. It's fine. Now, if those ligaments here, the round ligaments, are too tight, so they pull the uterus forward, then the uterus is bent back, bent like onto itself, almost like a capricin that's been folded up. And then when it tries to expel the blood, it has to work really, really hard and cramp really, really hard to get the blood out. And that's why you get period pain. The other alternative is if those ligaments at the back here are too tight, then the opposite happens. The uterus is going to be bent backwards. Obviously I'm exaggerating this because this is a very large uterus. And so, opposite, if your uterus is bent backward and it's also trying to empty the blood, it's having to work a lot harder to get the blood out, and that's why you get pain. And it's not woo, it's simple biomechanics. And I get so angry that women get told there's nothing you can do about it, because that's not true. It's just that the people who can help you, they're not within the Western medical model. So osteopath, chiropractor, and people who are trained in Arvigo or Mayan abdominal massage, basically anybody who can release the ligament. And my osteopath taught me how to do it myself, so now I don't, he released it at the time, and then it took 2 or 3 cycles for it to be fully released, and I have not needed anything since. But I know that if period pain came back, I would immediately go back for a top-up and make sure my ligaments are in tip-top condition. And I feel so strongly about this that I'm planning to train in Mayan abdominal massage with Hilary Lewin myself early next year, because I want to be able to offer this practice to women, and I want to spread the word that you don't have to just put up with period pain as this is something that you can't do anything about. Thank you.